One dried clove under your tongue, 30 seconds. No pill, no powder, no preparation. Just one whole dried clove, held under your tongue for half a minute. What makes this worth your attention has nothing to do with taste or digestion. It has everything to do with where the active compounds go and how fast they get there. Because there is a fundamental difference between swallowing something and absorbing it sublingually. And once you understand that difference, a lot of things about natural remedies will never look the same again. Stay until the end. There is a wrong way to do this, one that irritates your mouth lining and triggers stomach discomfort. I'll show you the exact safe method, the right frequency, and who should avoid this completely. Why under the tongue changes everything. When you swallow a spice or supplement, it travels through your entire digestive system first. Stomach acid breaks down compounds. Liver metabolism filters a significant portion before anything reaches circulation. By the time active compounds from something swallowed actually hit your blood vessels, a substantial fraction of the original potency is already gone. The tissue under your tongue works on a completely different principle. It is thin, richly supplied with blood vessels, and bypasses the digestive tract entirely. This is called sublingual absorption, the same principle behind certain cardiac medications. Nitroglycerin, for example, is administered sublingually precisely because speed and direct absorption matter when the heart is under stress. For certain small fat-soluble bioactive compounds, eugenol, the primary active compound in cloves, being one of them, sublingual contact offers faster and more direct access to circulation than swallowing ever could. That's the mechanism. Now let's talk about what eugenol actually does once it gets there. What's actually in a clove? Gram for gram. Dried cloves have one of the highest antioxidant capacities of any plant substance ever measured. Higher than blueberries, higher than cinnamon, higher than most foods celebrated for their antioxidant content. The primary bioactive compound is eugenol, making up roughly 70 to 90% of cloves' essential oil content. But cloves also contain flavonoids, camphorol, and rhamnettin, plus tannins, triterpenes, and phenolic compounds that work synergistically with eugenol. The result is a single small spice that touches multiple biological systems at once: cardiovascular, metabolic, neurological, inflammatory. Let's go through each one. Before benefit number 1, 99% of you watching right now are not subscribed. Hit subscribe and like this video. We're pushing toward 100,000 subscribers this month. 2 seconds. It means everything. Thank you. 1. Circulation and cardiovascular support. Eugenol has demonstrated vasodilatory properties in multiple studies. It helps relax the smooth muscle lining of blood vessel walls, allowing vessels to widen slightly. Relaxed vessels mean blood flows with less resistance. Less resistance means the heart works less hard. For someone over 50, when arteries are naturally stiffer, nitric oxide production is declining, and peripheral circulation often worsens noticeably. Even modest vessel relaxation has real consequences. Cold hands and feet in seniors are frequently a circulation issue, not just temperature sensitivity. This addresses the underlying mechanism. Eugenol has also shown mild antiplatelet activity in research, reducing the tendency of blood platelets to clump excessively. Never a substitute for prescribed anticoagulant therapy, but as a background supportive influence, biologically meaningful. 2. Blood sugar and metabolic support. This is one of the more surprising areas of clove research. Eugenol and certain flavonoids in cloves appear to support insulin receptor signaling, improving the efficiency with which cells respond to insulin. In practical terms, More stable blood glucose, particularly after meals when glucose typically spikes before insulin brings it back down. That post-meal glucose spike, repeated multiple times daily, every day over years, is one of the primary drivers of glycation, the process by which excess glucose damages proteins and tissues throughout the body, including artery walls and nerve tissue. Reducing the height and duration of that spike matters cumulatively, even when no single meal looks dramatic. Cloves won't replace dietary discipline or medication for anyone with diagnosed diabetes. But as a supportive habit used before meals, the metabolic signaling is backed by real research. 3. The nervous system effect most people overlook. Holding something under your tongue, especially something with a strong sensory profile like clove, activates a dense network of sensory nerves in the oral mucosa. These nerves connect directly to the vagus nerve, the primary highway of the parasympathetic nervous system. When the parasympathetic system activates, heart rate eases, blood pressure tends to drop slightly, cortisol decreases, and the body shifts away from the chronic stress state that quietly destroys cardiovascular health over decades. Chronic stress keeps cortisol elevated. Elevated cortisol keeps blood pressure elevated. Elevated blood pressure damages arterial walls. It's a loop, and breaking any point in that loop matters. The sublingual method creates a dual signal, chemical through eugenol, neurological through vagal activation, both pointing in the same direction. For 30 seconds in zero cost, that's a significant amount of physiological signaling. 4. Antioxidant protection for arteries and cells. Free radicals generated by metabolism, inflammation, poor diet, and stress damage arterial walls, pancreatic beta cells, cardiac muscle, and DNA. The cumulative effect of decades of oxidative damage is what accelerates cardiovascular disease and metabolic dysfunction. The antioxidants in cloves, eugenol, kaempferol, rhamnitine, oleanolic acid, have demonstrated protective effects on arterial endothelium and cardiac tissue in research settings. This doesn't reverse existing plaque. Nothing does that simply. What it does is reduce the ongoing oxidative assault that would otherwise continue accelerating damage. Slowing progression is a real and meaningful goal. Exactly how to do this safely. 1 whole dried clove, not ground, not clove oil, not extract. Place it under your tongue. Hold for 20 to 30 seconds. You'll feel a strong, warm, slightly numbing sensation. That's eugenol acting on local nerve receptors, the same compound used in dentistry for mild pain relief. Normal and harmless in this amount. After 30 seconds, remove and discard. Do not chew it raw on an empty stomach. Do not swallow it whole. And never use clove essential oil sublingually. The concentration will cause serious irritation to the mucous membrane. Frequency: 2 to 3 times per week. Not daily, not all day. Eugenol in excessive amounts can irritate the gut lining. The dose here is far below any concerning threshold. But consistency within a reasonable frequency is what produces benefit without risk. Best timing: before a meal or mid-morning, not before bed. The sensory activation can delay sleep onset in sensitive individuals. Who should not do this? If you take blood thinners, warfarin, heparin, or similar, the antiplatelet effect of eugenol can compound their action. Speak to your doctor first. If you have active mouth ulcers, wait until healed. If you have severe acid reflux, even trace amounts swallowed can aggravate symptoms. If you're allergic to cloves or balsam of Peru, avoid entirely. Any burning or significant irritation beyond the normal warm numbness, remove immediately and rinse with water. What this is and what it isn't. Not a replacement for blood pressure medication, not a treatment for heart disease, not a diabetes therapy. Anyone framing it as a cure is misleading you. What it is, a 30-second habit with real biological logic, antioxidant delivery, vessel relaxation, metabolic signaling, and parasympathetic activation, all at once, through a single whole food that costs almost nothing. Small signals, repeated consistently, create measurable shifts over time. That's not magic. That's how physiology works. The body listens to what you do every day. Make it worth listening to. Would you try this? Yes or no? Comment below. Subscribe for more simple science-backed habits for heart and metabolic health after 50.